I'm Neha. I am the lead product manager at K-Health. I primarily focus on our patient experience, but when we think of K-Health, it's sort of a three-pronged marketplace. I'm going to give you a quick overview of K-Health, and then I'm really excited to talk to you about how we have tackled growth in a B2B2C healthcare space, which is highly regulated and also deals a lot with sort of brand credibility and medical credibility when it comes to patients. I actually don't know how to move slides on this, I just realized. The green button? There's two green buttons. Okay. Okay, so welcome to the next 20 minutes of your life. This is going to be really exciting. K-Health is a virtual primary care clinic. We are a white labeled B2B platform. We partner with large health systems across the country to be their primary care clinic. And so you could think of health systems like Cedars-Sinai, Hartford Healthcare in Connecticut, Hackensack Meridian. We actually just launched a new partnership with Mass General in Massachusetts last Tuesday. And so we are an app-first virtual primary care clinic. What that means is that we have an app that is a white labeled experience that we basically brand for these healthcare clinics, and then run an entire clinic for them. And so this includes the doctors, this includes also all of the clinical operations that come with this. What's really interesting in this entire sort of growth journey when we think about it is that it's not really just about sort of app acquisition in a very traditional sense. It's actually a lot about partnering actually with our operations and sort of and our medical teams as well to really dive into some non-traditional channels to actually then try to acquire new patients. So when we think of sort of new patients for us, there's new patients to the app. These can be patients who already exist within this health system, and also new patients for that health system. And we're really trying to tackle both. So when we actually think of fueling growth, we're really looking at sort of 4 different pillars working together. The first is product, of course. The second is operations, third is marketing, and the fourth that we've recently in the last couple of months really started to embed into our growth practices is AI as well, more so in the form of Agentic AI, but really this comes just across the board and also all of our sort of workflows. So I'm going to first go into how we partner with operations. When I say operations for us, this is really the people who are sort of the first line of defense when it comes to managing patients. This is our support team. And so these are the people who really handle if you think about sort of going into a doctor's office, these are the people who are sort of checking you in along the way. What we've found to be most successful when it comes to growth in terms of working with operations is actually co-building our user flows with them. What this really means is actually taking all of the insights that they have and actually using this to optimize our patient journeys. We've found, given our operations team is the one who's actually on the phone talking to patients, we can actually take all of that call data, really transcribe it, use Claude, anything to really just dive into the data, extract themes, and then actually optimize our product funnel with everything that we're getting from there. And so when we actually think of sort of product-led growth, one of our key pillars and sort of key enablers is actually all of the insights that we get from our operations team. When we think of sort of like doing all of this, we have AI agents just throughout the entire process. And so our operations team actually also handles making calls to patients, sort of reaching out to patients. All of this is actually agentic now for us. And so what I mean by that is when we think of growth, it's sort of how do we actually sort of instill patient engagement throughout the entire product funnel. Of course, there's sort of these traditional channels of CRM in the form of sort of email, notifications, et cetera. We've also started using a lot of calls, primarily through AI agents to actually reach out to patients and actually bypass our entire funnel and just do the things that we need them to do, which is primarily schedule an appointment via a call. And a lot of this was actually fueled by partnering with our operations team. I'm going to next talk about marketing. So marketing, our journey with marketing has really changed over the last couple of years. We actually started first working with paid marketing. And so you can think of paid marketing in a very, very traditional sense, Google search ads. Some of it was also sort of like paid social. And what we actually found was primarily because we were B2B2C, paid marketing really wasn't successful for us. We tried to use paid marketing to get just pure app downloads, saw that it was extremely expensive and really not worth it. And so then we tried to optimize that further by introducing a sort of a lead gen web funnel. Again, that improved things, but if I don't know how many people here are in healthcare, healthcare is a highly regulated space, really, really difficult to be able to actually send signals back to all of your marketing platforms. So it makes running marketing in healthcare, any type of paid marketing, very, very difficult. So there's sort of different ways that you could try to work around this. We built out an algorithm, like a scoring algorithm, to try to use that as our signal for conversion. Again, it's not as good as just having like a checkout funnel, for example, where you just send the checkout event back to your platforms. So what we ended up doing was actually moving completely away from paid marketing and started to actually dive into sort of more patient engagement focused growth channels. And so really this is more focused on things like CRM, things like these outbound calls. One thing that when we think of healthcare is that it's a really, really high touch patient experience. That's really what people are looking for, is they want to feel like their needs are being heard. One thing that we actually did when we launched one of our clinics was any patient who actually downloaded an app, so now we're past app acquisition, but they've downloaded an app, they actually weren't taking any actions on the app. We introduced a welcome call. So it was actually a person who would reach out, call these patients. And with this introduction of our welcome call, we actually saw our conversion to, for us, it's visit, increase by about 20 to 25%. So highly, highly effective to introduce humans in the loop. Also extremely expensive. This is another great example of something that we actually have since replaced with an agentic solution. So now we actually do keep these outbound calls, but instead they're actually an agent who makes these calls. This agent then actually can perform all of the sort of the same tasks that the humans can, and also can route to a human if they sense that the patient or the user is getting frustrated. Another piece that I do want to talk about with marketing is how we introduced web into our experience. The K-Health platform is app first. So to have a visit, you do actually need to download the app. This is actually sort of very non-traditional for how people typically seek healthcare. If you think about your own healthcare experiences, you're probably either going in person or you're on a desktop and doing like a Zoom type call with your doctor. It's not as common that you're actually just on an app to have a visit, particularly when it comes to things like primary care. And so one of the things that we saw was when we introduced our web funnel, we actually did increase our conversion to app download. Originally, our drop off from sort of a landing page to app was about 80%, quite high. Once we introduced an optimized web funnel, that drop off went from 80% to actually 20%. So we saw a really, really big improvement by introducing this new web funnel. This web funnel actually went through a couple of different iterations, all in conjunction with marketing and getting marketing feedback. So our web funnel was actually originally launched with paid marketing in mind. Since we've turned paid marketing off, we've actually kept our web funnel on and have sort of maintained and retained that level of conversion across our product funnel. One of the big things that I'm just going to share with our web funnel is we actually don't accept payment. It's all insurance based. Or in healthcare, you can actually pay on your own. So you can do that, but we don't have sort of a payments flow within our experience. What we found was when we made it really easy for patients to schedule an appointment to see a doctor, we actually had a high volume of no-show rate, a high volume of no-shows, which means patients were actually taking a slot from someone else, and then ultimately our key KPI was actually going down, which is visits. when we added in a little bit of friction up front, which was specifically adding in insurance, so making sure that we can actually capture a patient's insurance before they actually confirm their appointment. And then also verify their insurance and give them that feedback up front. We actually saw our no-show rate go down, and then in conjunction actually saw that conversion rate go back up to what I was talking about earlier, and then also saw an uptick of about 15-ish% in our visit count. And so this is really exciting for us to see. Also was actually a very, very important input that our marketing team came with, which was originally we had launched this product funnel without insurance in the flow. And then by adding insurance, which was actually a marketing request after we reviewed the paid funnel specifically, we added insurance back in. So in addition to the web funnel, in addition to turning off paid marketing, what we've really found is that these sort of human-to-human touch points work really well in the healthcare space. And they also allow us to sort of maintain this B2B2C world in the sense of we can actually brand and theme all of these touch points to actually sort of match with our partners, sort of the way that they speak to their patients, also of course the branding as well, and maintain sort of this singular ecosystem that you really want with a white labeled experience. I'm finally going to talk about how we also partnered with AI. I've alluded to it quite a bit throughout, but we've really found in the last couple of months that introducing AI throughout the patient experience has been extremely, extremely helpful in terms of actually driving growth. This has really come in the form of, for us, outbound calls. And then also we've started to figure out how we can actually start to use AI to personalize a lot of the messages that we're sending via our traditional CRM channels. And so with this, we've built out an AI agent. It can actually sort of handle sort of high-level support questions. It can also do sort of the main things that you really want a patient to do to see sort of success, which is schedule an appointment, and then really help the patient get to their appointment. And we've sort of just launched this in the last couple of weeks, so it's still a little bit early to see true metrics, but we are seeing that in terms of sort of helping the operations team sort of feel less burden, and in terms of patient satisfaction, we're actually seeing really, really positive signs. One of the things that we were worried about is that we would get a lot of patient complaints because they would actually be sort of more interested in talking to a human. We haven't seen that come through. We have seen a lot of success with a lot of the agentic solutions that we're sort of injecting throughout the flow. So when we think of sort of bringing all of these teams together, one of the really important things was also figuring out how we measure this. My background is actually in analytics, so I have a really strong passion for data, and everything needs to sort of be powered by having this unified goal. We know what our unified goal is across the three teams and across the companies, but each team having its own metrics and sort of its own style of measurement. When we bring all of those together, that's when we actually saw the most success. And so for product, it was really looking at the product funnel. For our operations team, it was a lot more sort of operational metrics, like looking at things like how much time they're spending supporting patients. And then for the marketing side, pivoting away from paid marketing, it really became about user engagement. And so sort of when are people more interested in email versus SMS when it comes to actually getting them to a visit? When do push notifications actually sort of make a difference? When do live activities? I think live activities has actually been a really powerful feature for us to getting patients into a visit. So when do sort of live activities take hold and start to really dominate the patient journey when we think about access to care? And so we've talked about sort of this overarching view of moving away from paid marketing sort of in a more traditional sense. When we think about sort of B2B2C healthcare and really that brand credibility, there's a lot of restrictions that we have to think through when it comes to paid marketing. And what we ultimately found was that the cost-wise, it just didn't really make sense. And so we really leaned into product-led growth. One of the things that I do want to call out is sort of the role that web played in all of this. Katerina, you kind of mentioned it earlier. People still do use websites, particularly when it comes to healthcare. And one of the things that we saw was that with an app, no matter how rich the experience is, we would always have a hole in terms of actually addressing our full market if we didn't launch a web experience. And so last week, we actually just launched our first web visit experience where a patient can actually also have a visit on web. We have seen it be successful. It has actually a stronger funnel than our app does. But we still actually see the two playing very different roles. The web visit experience that we've launched just isn't as rich as an app can be. People do use websites, but websites also are sometimes clunkier than apps really are. And so a web experience tends to be, at least for us, it is a little bit more of a lighter experience. And we're actually seeing that it's a lot stronger when it comes to sort of existing patients and really embedding into an existing patient workflow. But our app has actually been more successful in terms of acquiring new patients to the health systems. And so it's been really interesting to sort of see how web and app can coexist with each other and actually sort of complement each other when it comes to the patient journey. And so here are key takeaways. I won't repeat them because I just talked for 15 minutes. But if you have any questions, please do let me know. I think some really big points to focus on are in the B2B2C space. A lot of these non-traditional paid channels just don't always work in the same way. So really focusing on how you can actually lean into that human touch and also lean into where people actually are and meeting them where they are is really important. Embedding AI throughout the workflow is real, it's happening, and it's actually very exciting to do. And it's very exciting to see how people respond to it. And it tends to be a little bit more positive than you might think it is. And then, of course, you just really need to partner with operations or just sort of any other teams you have to actually have this holistic user experience and a holistic view of who your users are and what they really need to be successful. So thank you, everyone. And feel free to scan this if you want to chat with me or have any questions. I think thank you. I think we do have a few minutes left if anyone does have any questions right now. Yes.
Could you talk a little bit about how you thought about what partner LLM to use for that? I know there's some that focus specifically in that type of, voice outbounding. There's obviously the general models. And then maybe as a follow-up, how did you measure or think about getting patient feedback on how they feel, or did they know like they were getting called by AI?
Yeah, really great question. We first actually came up with a list of use cases where we think AI could actually be embedded into this patient journey when it came to outbound calls. That actually drove a lot of the decision making. With that, then we started to focus on partners. We were very, very specifically interested in calls as our first use case. And so we work with a partner called Vappy to actually support making a lot of these calls. And in conjunction with them have actually started to build out now our entire outbound calling solution. And so a lot of that is driven primarily by the use cases. In terms of measurement, the first thing was, okay, what use cases will sort of be the least sort of controversial? That was our sort of warm entry into these agentic calls. We did try to personalize the calls as much as we can. So I think if you have a keen ear, it is actually very obvious that it's a robot or an AI agent. It's not a human. But it does flow in the same way that sort of a human's voice would. And that took a lot of iteration, but that was something that was important to us. And so we did try to personalize it as much as we could. In terms of measurement, the measurement has sort of come in a couple of different ways. One is scheduling has been our first use case. And so it's can we actually use these calls to have patients schedule an appointment over the phone? So scheduling has sort of a clear metric to it. Is how many appointments can you schedule? What does that conversion rate look like for call to sort of appointment ratio? The second is sort of how many calls are actually routed to an agent. So and when I say agent for us, it actually means a real person. So it's how many calls get routed to a real person. And then the third is we actually do have all of this call data that we can look into to just see if there's any themes or patterns in terms of sort of patient frustration. that we're not getting just from sort of the routing. But we have found it has been pretty good at sort of detecting frustration, and then, like all of these agents you can make to be as risk averse or sort of risk or sort of like pro risk as you want them to be. Ours is quite risk averse. And so we have found it to be very, very good at sort of identifying when there's frustration and then rerouting to a human.